Good afternoon. Thank you very much for the invitation here, coming to Prague and talking about children hospice work in Germany. I'm Thorsten Hillmann, working for an organization called Deutscher Kinderhospizverein. In English, German Children Hospice Society. It's not a public organization, it's not a governmental organization, it's a private organization founded in 1990 by 5 families which were affected having children with life-shortening diseases. And that's a main point in our organizational history, that even we're working with professionals and with professional staff, we are working with voluntary staff, and we consider the experiences of the parents, because we were founded by parents. How's the situation in Germany? The supply of life-shortening diseased children, youth and young grown-ups. We make a difference between children and youth and young grown-ups in Germany. We have children hospitals and pediatricians. 3 years ago we started so-called SAPV teams. Specialized ambulant palliative care means we have teams with medical care, nursing. The children hospice service is partner of the team, and spiritual care. Then we have inpatient hospices for children and many outpatient children's hospice services. And this last point on this list is the main focus of my speech. Figures, data and facts. The situation in Germany in 2014. We have 118 outpatient children's hospice services all over Germany. And also all over Germany, from north to south, 13 inpatient hospices for children and 2 inpatient hospices for young grown-ups. That's an example for the difference we make there. The organization Deutscher Kinderhospizverein includes in this year 2,864 members, and we run 20 outpatient children's hospice services. And this year, September 2014, we care for 369 families. And we do that, that's an important point, we do that with professional staff, but we also do that, we do that with voluntary employees. We do that with today 748 voluntary employees. What are the main characteristic features of our children hospice work? We have to deal with many different diseases, but less children getting infected with cancer. And we have a lot of children who are seriously, physically and mentally handicapped and disabled. We're caring for a long time, often for years. And we have to deal with many fellows in the care system. And that's the point. Children depend on their parents. That's a different to adults. So, as a consequence, the whole social environment has an important effect. And in our way we see it, children hospice work refers to the whole family. And we have in our ambulant work a large draw area, so we have to take long journeys to the family, for example 50 kilometers. What are the life-shortening diseases in childhood we have to deal with? First, metabolic diseases, for example, mucopolysaccharidosis. I've trained to speak that word. Genetic diseases, muscular disorders, for example, Duchenne muscular disorders, severe brain damage caused by a lack of oxygen at birth or caused by accident, and cancer. Here I want to say we accompany families with children who suffered from cancer, but we check or speak with the family if cancer is life-threatened, and if life-threatened themes are in the family, then we care. But we know that most of all children suffering from cancer getting healed. What's the situation of the family? The course of disease of the child spans often for years. Meanwhile, the children of other families grow up, and I think that's an important point to realize. Meanwhile, the children of other families grow up, their own gradually lose their abilities and are approaching the final stage of life. And this has a deep impact on the partnership. Siblings are heavily burdened, and the care of the sick child and the constant presence of illness, dying, death and grief lead to a massive mental and physical overload. And this leads, for example, in social isolation. Prevalence of childhood diseases in Germany: 22,600 children and adolescents with life-shortening diseases, approximately 28 children and young per 100,000 people, and annually there are 1,500 children and youth dying in Germany due to their disease, about 520 thereof due to cancer. Financing of children hospice work in Germany. There is sourcing by health insurance on basis of statutory provisions. We have social laws called paragraph 39 and paragraph 132 for the outpatient children's hospice services, and for since 3 years for the SAPV teams. But that's not really a financing, it's more an alimentation. So we need donations, and we need voluntary work. What does outpatient children hospice work? Support of families with children, youth and young grown-ups suffering from a life-shortening disease by offering psychosocial support, information and counseling. And that's important. Support of the whole family meets or includes from the day of the diagnosis of a life-limiting illness, in life and death, and after the children, youth or young grown-ups have passed away. So we as an organization guarantee accompaniment for the families. Maybe not the person, the volunteer stays for many years, but we as Deutscher Kinderhospizverein guarantee for the families accompaniment. Support and promotion of self-help is an important point for us. We were founded by families, and the self-help for families is an important point for us. Another point, intermediation of other facilities, individual grief counseling, and guidance for kindergarten and schools. Our aim is to balance the family system as well as the quality of life within the family. In other words, strengthen resources in the family and improve quality of life. The mode of practice in outpatient children's hospice services run by the Deutscher Kinderhospizverein. The Company of Families focuses on the abilities, needs and interests of affected children. Abilities, needs and interests. However, the children are, what diseases the children have. And their siblings and parents. And that's the point. The action is carried out in close consultation with the parents, who are respected as experts in the interests of their child. It's one of our most important principles that we respect parents as experts for their own children. The coordination of an outpatient children and youth hospice service is taken over by a full-time professional. The accompaniment of families is carried out by trained volunteer staff. And the offer is free of charge to the families. Precise help by volunteer staff. Being open to the concerns of the family, listening, provide with information, providing further assistance if required, childcare, sisters and brothers of the deceased child, driving service if necessary, recreational activities, or simply be there and stay there. Stay there, although it will be very difficult one day. Further possible offers of outpatient children and youth hospice services according to the needs of the families and according to the capacities of the hospice services. We offer family cafes, we offer holidays for children and youth, we make possibilities for parents meeting each other, groups in which fathers can get together, only fathers, groups, similar groups for mothers as well. Siblings are brought in contact groups, and groups for family members which are in mourning after the child has passed away. What are the tasks of the full-time professional coordination in the children hospice service? First, contact the affected families in the region, acquisition and training of volunteers, support the volunteers in their work, coordination and documentation of the accompaniment of the families, public relations and networking, for example, with institutions of the health, social system, schools, kindergarten, pediatrics, children's clinic, children nursing service, etc. What are the limits of an outpatient children's hospice service? Outpatient children and youth hospice services offer no pediatric nursing. We replace not neighborly help in communities. We replace not medical, psychological, therapeutical professionals or church chaplains. And we accompany exclusively children and young people with life-limiting illness. Thank you for your interest and your attention.